Just making sure that works. Well, thank you all for having me. As she was saying, I am Senator Bill Cassidy from Louisiana's health policy advisor. He's a physician, a gastroenterologist, and he brings the interesting perspective to Congress of both being a physician, a conservative from a deep red state in the South, but he also worked in the charity care system in Louisiana for 25 years. So he brings an interesting perspective in recognizing the importance of coverage and how the system works, in particular for poor or uninsured patients. It's an interesting time in the healthcare policy world right now. And I think that it also presents a lot of opportunities to move forward on legislation, in particular in a bipartisan manner. There obviously are a lot of conversations going on in the ACA realm, and with everything going on with the individual markets and some of the instability and what's going to happen on that front. But I do think that there is a growing understanding of the issues of patients with multiple chronic conditions and the impact it is having both on a federal budget standpoint, a state budget standpoint, and the social safety net, as well as just a patient outcomes perspective and the importance of making sure that patients have access to high quality care and the latest innovative models of care delivery. And I do think that there's a bipartisan recognition of that having to be an area of focus, and that a large driver of that is patients combating obesity. I think that members are still learning in some ways the connection between obesity and other chronic conditions and where the touch points are within the system. And I think that's why you all play an important role in educating members of Congress about what that connection, as well as the different tools that are available to providers in engaging those patients. Our bosses just yesterday, or is that today? I can't even keep track. Introduced the Treat and Reduce Obesity Act, focused on increasing coverage, particularly in the Medicare space, for patients to be able to have access to obesity-related drugs, as well as allowing more providers to provide intentional behavioral therapy. It's generated a lot of good bipartisan support. We're hopeful to move forward on that. The Senate Finance Committee, of which both our bosses are members of, has done a lot of work in the chronic care space. So I do think that there is some good bipartisan synergy going on in this, despite the larger, frankly, more partisan conversations around the ACA, what to do, how we advance. But we certainly appreciate your advocacy, your thoughts, especially on the ground in terms of what type of innovative care delivery models are working, what are the barriers you guys face in terms of reimbursement, in terms of regulatory issues that might exist, lack of coverage, patient adherence and patient engagement. I think we really have to have serious conversations about these issues so that we can get at the cost drivers and really focus on that growing patient group that is driving a lot of the higher costs, worse outcomes, and that is leading to all these comorbidities. And so we appreciate your advocacy, your engagement on these issues. My bosses literally wakes up at 3 or 4 in the morning with health policy ideas for anyone who's ever met him. So feel free to reach out to us anytime with your thoughts or ideas, with questions about how we move forward to engage in these areas. So with that, I'll turn it over to Lynn.
Lynn, do you want to go next?